Welcome to the Medication Administration Safety Simulation Entrance Pass Assignment. You are required to complete this module prior to your simulation date. Please refer to the course planner for the due date. If you have trouble accessing this assignment or completing the gaming portion that follows, please contact one of the simulation faculty or your course coordinator. Upon completion of the Medication Administration Safety Simulation Entrance Pass assignment, learners should be able to describe the safety principles of medication administration, list the safety steps of medication administration, and demonstrate the proper sequence for administering medication. This module replicates content that you learned during your first semester in the pre-licensure BSN program. During this semester, you will apply the medication knowledge that you've covered, so consider this your refresher. Patient safety is paramount, and medication administration provides lots of opportunities for errors. That being said, let's remind you about how medications should be given before you start this skill in clinical practice. The Institute of Medicine's first Quality Chasm report, To Err is Human, Building a Safer System, stated that medication-related errors were a significant cause of morbidity and mortality. Med errors accounted for 1 out of every 131 outpatient deaths and 1 out of every 854 inpatient deaths, and account for more than 7,000 deaths annually. The IOM has emphasized the importance of significantly reducing the number of medication errors and improving communication about medications with patients. Every time that you give a medication, you will need to systematically and conscientiously follow the safety steps or medication rights and involve your patient and/or their family when possible. A complete medication order will always include the following components: the date and time the medication was ordered, the name of the medication. Both generic and trade names are acceptable, but abbreviations should not be used. The dose, including units for the medication. The route, including form of the medication. For example, oral medications can either be pills or liquids. The order should specify. The frequency of administration. This should include the time of the first expected dose. The name of the prescriber. If a medication order doesn't contain all of the components, the nurse should call the prescriber to clarify the order and ask the provider to update the order, or the nurse should document the new order as a verbal order confirmed by readback. Throughout this module, we will focus on the medication safety practices listed on this slide. These include the right patient, medication, dose, route and form, time, documentation, reason, and response. You will note that different resources refer to these as medication rights and have varying numbers like the 6, 8, 10, or 12 rights. We intentionally omitted a number, but expect that you will follow these safety guidelines every time you administer medications. First, you need to identify the right patient. Ask the name of the patient and check his or her ID band before giving the medication. Even if you know that patient's name, you still need to ask just to verify. Verify the patient identification with the second identifier used in your institution, often the person's date of birth or medical record number. When available, use the barcode scanning technology found at most hospitals as your double check. Remember, all competent patients have the right to refuse or decline to take medications. The right medication. Verify the name of the medication or drug. Look up the drug using a book or online reference if you are not familiar with it. Beware of sound-alike and look-alike or salad drug names. Misreading medication names that look similar is a common mistake. These look-alike medication names may also sound alike and can lead to errors associated with verbal prescriptions. The right dose. Verify the medication with the Medication Administration Record, or MAR, before medicating. Be aware of the differences in dosages. Some medications are used at different doses based on the illness, for example, antibiotics, or patient's response to the medication, like blood pressure medications. Also be aware that there are significant differences between adult and pediatric doses. Calculate the drug dose as needed and verify with another nurse independently as required by your institution's policy. The right route and form. Check the order to determine what route the medication is supposed to be given. Pain medications like morphine are available in oral and injectable forms. Morphine can be given as a pill or an elixir orally, and as an injectable that can be given either intramuscularly or intravenously. Also consider whether the route is appropriate for the patient. A medication order for oral antihypertensive medications may have been appropriate yesterday, but today your patient is NPO for a procedure. This will require a conversation with the prescriber to determine an appropriate change to the plan of care. Oh, and one more thing to consider in your growing list. Has your patient passed a swallow screen, and is that patient able to safely take medications orally? The right time. Check the order for when the medication should be given. Also, don't forget to look at the frequency. When was the last time the patient received a dose? Has an appropriate amount of time lapsed? Frequently, patients receive medications off schedule due to being off the floor for testing. This is a great safety double check. The right documentation. In institutions where computerized medication administration is used, documentation is recorded by scanning the patient, medication, and self. Sometimes this requires the nurse to manually enter the dosage being given, especially when giving a partial dose like half a tablet or a portion of the vial that was already scanned. Make sure that you include pertinent information like vital signs or lab results when documenting. The right reason. Consider why the patient is getting this medication. Does it make sense? If you aren't sure, look it up and ask clarifying questions as needed. Nurses are the last safety check of the order, written by a prescriber and verified by a pharmacist. Be that care team member's wingman. If it doesn't seem right, don't do it. Use this opportunity to teach your patient about the medication. Provide enough knowledge to the patient of what the drug is, why it's being given, and what are the expected therapeutic and side effects. What information does this patient need to know about this drug? Again, remember that a competent adult patient does have the right to refuse the medication. The right response. Did your patient respond as expected? What assessments must be completed and documented? Do you need to reassess pain levels or blood pressure and heart rate? When should you reassess? This will depend on the route by which the medication was given. As soon as 5 to 15 minutes for IV push, or as long as 30 to 60 minutes for many oral medications. Once you have completed all of those checks, you are ready to administer the medication to the patient. A thorough explanation follows, but the sequence for scanning should always be PAMS: patient identification, allergy verification, medication verification, and self-identification. First, you enter the room and introduce yourself and perform hand hygiene. Then you identify the patient using 2 unique identifiers. The most commonly used are the patient's name and date of birth, as most patients can easily recall those. So ask the patient their name and date of birth or verify that number on their armband. You will then go to retrieve the medication that is ordered. Next, you will get the medication out of the Omnicell or Pyxis. You will sign into the Omnicell or Pyxis using your username and password. You will then locate the patient by name and highlight that information to gain access to the patient's medication administration record, or MAR. Once you have gained access to the MAR, you will then highlight the medication to be administered. Click on the medication name to remove it. The appropriate drawer or bin will open, and you will retrieve the medication. Check the medication expiration date at that time. At this point, you should also make sure that you have the right dose and form of the medication. You will also make sure that you are giving the medication for the correct indication and at the correct time. When you re-enter the room with the medication and the computer workstation, you will perform hand hygiene and identify your patient again. This time, when you ask for the patient's name and date of birth, you will confirm their identity by using the scanner. Now you ask the patient their allergies. This is paramount at this point. Once the medication has been administered, you cannot get it back. Giving the patient a medication to which they are allergic could result in death. This is also a great time to talk to the patient about the therapeutic effects, side effects, and signs of an allergic reaction that the patient would need to know about. Now you scan the medication's barcode, confirming once again that you are administering the appropriate medication. Prepare the medication, either drawing it up for an injection or opening the medication and placing it in a cup. Now scan your own badge and then administer the medication. Don't forget, some medications are considered high risk. Those medications require a double check with another nurse. The nurse should be at the bedside verifying the same medication administration safety checks independently prior to co-signing the medication administration. The last part of safe medication administration is for any follow-up that may need to be done. Medication follow-up should be completed within an appropriate time frame based on the route of administration. This could be as soon as 5 to 15 minutes for IV push, or as long as 30 to 60 minutes for many oral medications. Now you will have an opportunity to practice safe medication administration on your own in a gaming environment. You will practice until you have completed the steps safely. Remember to let us know if you need help working through the technology. We know that not all students are gamers, and this style of learning might be new to you. Once you have completed the safe medication practices correctly, print off your certificate. This certificate will be your entrance pass to the medication administration simulation. This is the entrance pass that you need to bring to your simulation experience. Please print it and bring it to the lab.